just make the best of things, right? So we're really glad you're here. And I want you all to know that we were planning this workshop in the winter, in January, and it was scheduled for April 15th, Income Tax Day. It was going to be at the library after chair yoga, and you all were going to get boxed lunches. And how things changed, we all had to shut things down because of COVID. So thank you for coming, and we're really appreciative of the Park Forest Library for hosting this, and also the National Council on Aging for the Boost Your Budget event. So we'll go on to the next slide.
Oh, come on now. There we go. Wait. Yep, there we go. Sorry.
Okay, we're all good. We're totally good. So
Okay.
I don't know if I introduced myself. My name is Joy Aronson. I work for AgeOptions, and my position is Benefits Access and Information Specialist. And you might ask, I don't know. Yes, so the question is yes, so please stay. The question was, do you have to be 65 to get any of the benefits? And the person that asked the question said that they are disabled. So it's for, I'll get into that, but it's for people who have disabilities and are over 60. So we are a 501c3, and that's a nonprofit. And we were established in 1974 and designated by, and let me just warn you, there's a lot of alphabet soup in this presentation, a lot of abbreviations and acronyms. IDOA stands for the Illinois Department on Aging, as the Suburban Cook County Area Agency on Aging, or AAA. So we serve suburban Cook County, and our service area has 30 townships, 130 communities, and we serve approximately 573,000 older adults. So that's over 500,000 people. Our funding comes from state, federal, corporate, private foundations, and individual donations. So now we'll go on to the next slide. And AgeOptions innovates, partners, and advocates to improve systems and services in order to strengthen communities so people thrive as they age. Okay, so now we're going to talk about our role as a AAA. And I have to say that in other parts of life, if somebody said AAA, you would think about getting your car towed or getting a battery jump, right? And I am actually a member of the AAA, but in this case, again, it's the Area Agency on Aging. And we serve people that are 60 and above and people with disabilities. And we also fund local agencies to provide services directly to community members. And some of the services, I'm not going to say every one of them, but they include in-home care and adult day services, congregate means group, meals like lunches. Back in the pre-COVID days, there would be lunches and an entertainment educational component like bingo, a talk, etc. And we are sure hoping that that comes back post-COVID, and post-COVID is this sooner rather than later, right? Also home delivered meals, caregiver support, and caregiver is non-paid caregiver, like a family member, a neighbor, etc. Elder abuse, Medicare education, etc. So in FY, and that stands for fiscal year 2019, AgeOptions and our funded partners served 172,077 individuals. So we'll keep going. And we support programs and services that make it possible for older adults to live independently in their homes and communities, which is what many of us want in our lives. So I'm going to give you a brief disclaimer. We're talking about public benefits. The public benefits eligibility criteria changes periodically. So information in this presentation is accurate as of September 2020. And we are not responsible for determination of eligibility or the amount of benefits granted. So you should always consult with current eligibility guidelines at the time of application. So I did a presentation at a library in early March. So I remember this very distinctly because that was the last in-person one I did. And I mentioned that AgeOptions does not make a determination nor set the amount of money for SNAP. And I guess I said it a few times because at the end of the presentation, a gentleman raised his hand and said, you know, you said that 8 times. I said, well, then it must be true. Okay, we'll keep continuing. So the benefits access goal is to increase the financial stability of older adults and persons with disability through enrollment in, and I'll talk about some of the programs that there are. Okay, so the first one is called Medicare Savings Program. Of course, it has an acronym, it's MSP. It's actually through Medicaid, and I'm not going to go into a lot of detail about Medicare because that could be like a week-long workshop. There's many different aspects, but Medicare has several different parts. And for Part A, that's the part that's hospitalization. And if people have worked 40 quarters or 10 years, they've paid into it. You don't pay when you are of the age of getting Medicare. Part B, like boy, is outpatient. So that's your doctor's visits, your labs, your diagnostics, etc. And folks who have the original Medicare also would get a drug plan and a supplement, so they wouldn't be responsible for the 20% that the Part B doesn't cover. And then there's also another, just as an aside, another way to get Medicare, and that's through an Advantage plan, which puts it all together. This Medicare Savings program is for pretty low income folks. So it's less than $1,088 for an individual to $1,461. There's different tiers. So it may also pay for deductibles and coinsurance. And there's another part, and that's called extra help. And that's slightly confusing because sometimes our clients say, I need extra help. Well, extra help, could be a general term of needing extra assistance, but this is for drugs specifically. It's, of course, has another name called the Low Income Subsidy, or LIS. And that works with coordinating Medicare Part D plans. D, I always remember, is for drugs. So it makes it so there's no or low income, no or low premium and deductible, and low co-payments of the drugs. And just so you know, for this part, this goes through Social Security, the SSA, Social Security Administration. The applications go to them and they make the decision for extra help. So we're going to move on from Medicare to food. And we're going to talk about the Supplemental Nutrition Assistance Program, also called SNAP. And that's to help people buy groceries. So SNAP, you probably heard, like families can get SNAP, individual adults can get SNAP. Our guidelines are for the people that we serve, and that's for 60 and above, blind or disabled. And for the folks that we serve, they have to meet the gross monthly income standards. And gross is before taxes are taken out, or before, if somebody's collecting Social Security, before their Part B premium, which right now is $144.60, is taken out. So it's less than $2,082 for an individual, and for a household of two, it's less than $2,818. And the way households work is people that live together and eat together. So, and if there's more people in the household, the amount increases. So in this particular benefit, assets do not matter. They don't care what's in your bank account. They do take into consideration monthly expenses, and that's living expenses. So rent, mortgage, property taxes, homeowners insurance, utilities, medical bills, Medicare premiums, etc. It's put into a formula. Unfortunately, monthly expenses don't include credit card debt or your car notes. And the range for one person in terms of getting benefits is between $16 and $194. So, and just so you know, in the pandemic, people, because it was an emergency, people were getting the maximum. So SNAP, I love apple pie. Apples are like one of my favorite fruits. So I'm trying to give you an image, right? SNAP is not apple pie. So any kind of pie, whether it's you like cherry or lemon meringue or apple, or a pizza, right? You usually take the pie and you cut it into equal pieces, because if one person gets half the pie and somebody else gets a sliver, it doesn't go over well. Okay, so when all the pieces of the pie are gone, then the pie is gone, but that is not the way it works for SNAP. And I've been lucky enough to do a number of different presentations to groups, and I've often had an older adult say to me, you know what, it's okay. I know how to get by. I can scrimp, I can save. You give this to the young kids because they're growing. They need their milk, they need their nutrition. And I get to say to them, you know what? This is for everybody. If you're entitled to the benefit, you get it. It's not like a pie. I also just want to share some economic numbers with you. So the statistics from the economists right now are saying that for each $1 in SNAP benefits in a downturn, and we are in a downturn, right? That generates between $1.50 and $1.80 in economic activity. So it's good for the economy and it's good for people. So we'll keep going. So I just want to share with you, I remember, and I don't know if anyone in our, I was going to say in the room, but in the Zoom room, right, remembers SNAP was called food stamps, and now people call it food stamps too. Used to be in a booklet, and it was different denominations, different colors. And I can remember this story so distinctly. So I was in the grocery store. Behind me was a gentleman, in front of me was a gentleman. The gentleman in front of me was paying for his purchases with food stamps. And it was quite visible because he had to take out the $5 denominations, the $10 denominations, etc. The gentleman behind me was really angry and very loud. And I can still to this day remember him yelling, "That's not right. He's getting steak and I can only afford hamburger, and he's got food stamps and I don't, and that's wrong." And everybody around could hear him. The person paying for the groceries with the food stamp booklet was absolutely mortified, as any of us would be. Okay, so that was then, and it was a stigma, right? Now it's a link card, it's a debit card, it's a blue card. And most people that when I go grocery shopping, I don't know about you, pay for the groceries with either a debit card or a credit card. I see very few folks taking out cash or a check. So it's not so visible. So that's my point there. Well, let's move on to transportation. So one of the benefits that we help people apply for. So just to review, we help people apply for SNAP. We help people apply for the Medicare Savings Program. We also help people apply for the license plate discount, the sticker, and something called Seniors Ride Free for public transportation. And a person can get both. So for this particular benefit, You must be 65 years or older, or someone with a disability, and live in the state of Illinois, because state of Illinois does not want to pay for people from adjoining states, which we can understand. The guidelines are higher than other of the benefits that I talked about. So the income limit here is $33,562 a year for an individual, or $44,533 a year for a couple. And you can only apply online. And that's the web apps, that's the link. You all can do it, or we can do it on your behalf. It's really one of the easiest benefits to apply for, because they don't ask for a whole lot of information. To get a license plate sticker, because I just did that, it costs to the general public $151 right now. And this discount is for $127. So if you're entitled to the discount, you're only paying $24 instead of $151. It's super easy to do online. If someone is only getting Social Security, then they don't ask for additional documentation. If someone has filing taxes, they can come back and ask for a copy of that. Or if someone has a part-time job, they often want to see that. But you put the application in, there's a notice that says check back in 48 hours. Usually they can process it a lot sooner, and it's either approved or they're looking for more information. So I just wanted to tell you how in the computer world, how things work, because I did a presentation maybe about a year ago in a senior building. And so we used to do, and we will do again after COVID, we would do a presentation like this, but in person. And you could raise your hand during it, and we would bring up different fruits, and we'd do a game, and you get to take oranges and bananas home. And it was nice. I miss it. Anyway, so I did this presentation at a senior building, and then we come back the next week. We tell people what documents we need for different kinds of benefits to file, to please bring them. And we would have our laptops, calculators sitting away so that people wouldn't hear personal information. So I was working with a gentleman, and I came back to the office. I was so excited because it seemed like he was entitled to so many different benefits. I mean, I was walking on air, because for people like me, helping folks get benefits, we just live for that. So it didn't appear from what he told me that he had any income. So I started with this BAA for the license plate discount, and he was rejected. And I was absolutely shocked, because I mean, his income was so low, so very low. And I called downtown, and I didn't want the specifics. I said, maybe I put something in wrong, and they said, I can't give you the specifics, but actually the Department of Employment Security, we're connected to that, and he's working, he's earning money. So I just, the way it works in the computer world is the state of Illinois computer talks to the Social Security computer, talks to the Department of Employment Security computer, and computers are talking to each other. So I called him and said, this is the case. And he said, well, it's none of the state of Illinois' business that I'm working. And I said, well, actually, when you want to get benefits, it is. So I'm really sorry. And so we were done with that. So just an aside story. Okay, so the low income home energy assistance program, and also, of course, it has an abbreviation. Hold on, I'm going to get a little drink. It's called LIHEAP. We do not administer it. It's the CEDA, or Community and Economic Development Association in Cook County. And it assists low-income folks. It's usually a one-time benefit for eligible households for their energy bill, and may offer furnace assistance or repair or replace. And Basically, it's by income, size of the household, fuel type, and geographic area, because Southern Illinois is different than Northern Illinois. So pretty soon, seniors and folks with disabilities will have priority. So you can go online to c.org.net or call the LIHEAP hotline at 877-411-9276. Okay, so let's just go on. I'm going to talk to you about a couple helpful resources. And the first one is called the Benefits Checkup. And that's created by the National Council on Aging. And the National Council on Aging are the ones that sponsored this Boost Your Budget. This is the first year. And they gave grants to different agencies throughout the United States to do outreach to folks on fixed incomes. So they have this national database. It's geared for people 55 years and older, and it screens for over 2,000 benefit programs. So if people have a computer and internet access, which I think everybody on the call does, right? You just go to www.benefitscheckup.org. Okay, and then another resource which is really important is Medicare.gov. So probably many of you know that for an internet site, it could be COM, which is business. Our organization is, because we're nonprofit, is org, and anything with the government is gov. So this is the official government site for Medicare, and it's a way to sign up and change plans. There's helpful forms, there's help, there's a chat box, there's resources, there's a way to file claims and appeals, and you can find out what Medicare does or doesn't cover. So it's medicare.gov. And just as a point of information, the open enrollment period for Medicare, and it's yearly, begins on October 15th, goes to December 7th. And at that time, you can change from a Medicare Advantage to a original Medicare plan. You can change your drug plan, etc. And the website has gotten much more consumer friendly. I'm going to get to go to a workshop, of course, online to learn about some of the new features in schedule for next week. Okay, so we're coming to the end. So many people have relatives or friends that live in other parts of the United States or other parts of Illinois, and you want to know how to help them. They might need services too. So there's something called an elder locator. It's a public service from the U.S. Administration on Aging, and it gives lots of referral information. So it will give a referral to the AAA, which is the Area Agency on Aging, not the American Automobile Association, and give you information about SHIP sites. SHIP is the Senior Health Insurance Program, which helps people with Medicare. Whoopsie, I've got a little with my computer. With Medicare programs, legal services, elder abuse, long-term care ombudsman, and it's just eldercare.gov. So you can just check that out. And then another resource is, additional resource is for people who have disabilities. So there's several. If you're in suburban Cook County and you're under the age of 60 and have a disability, there's an organization called Progress Center for Independent Living. And that's the 708-209-1500. And that they have offices one in Forest Park in the western suburbs and another in Blue Island in the south suburbs where you all are located. A lot of resources there. For folks in the city, the organization is called Access Living. And then if people want to learn about centers for independent living, in Illinois by county, you can go to the website incil.org, and then there's different locations. Okay, so if you are in suburban Cook County, we are your area agency on aging. We are AgeOptions. Our number is 708-383-0258. And you can call and ask for benefits because it's more than, there's a team of people. We have volunteers and staff. And right now we're all working remotely. So you can call and ask for benefits and they'll put you into our voicemail. If you know someone lives in the city of Chicago, that goes to the Chicago Department of Family and Support Services, Senior Services. And that number's 312-744-4016. And then if you're in the collar counties, so outside of suburban Cook County, that would be Lake, Kendall, Kane, etc. And there's a lot of them. That agency, that area agency on aging, is called Age Guide. And they have an 800 number because you would call them and then they would connect you to the county you're in. So it's 1-800-528-2000. Okay, so when we were going to do this presentation on April 15th after chair yoga with the box lunches, the local Aging and Disability Resource Network and the Case Coordination Unit for the South Suburbs, and they're called South Suburban Senior Services of Catholic Charities, they were going to come with. And since they couldn't do that and we can't do it in person, they sent me some slides. So they wanted everyone to know that their service area includes the South Suburban Townships of Bloom, Bremen, Calumet, Rich, and Thornton. And that's 44 communities. And they are the first contact for those seeking programs, information, or referrals. And they would do an assessment to try to link folks to the proper unit and services. Okay, let me tell you a little bit more about them. So they have many services, and they have Senior Medicare Patrol. They have the RTA Reduced Fare Program, Adult Daycare, Homemaker, Emergency Home Response, Options Counseling, Senior Health Assistance Program, Senior Health Insurance Program. And so especially if you're going to need some help with help at home for a loved one, etc. And if you want to meet face-to-face, not now, unfortunately, but in the future, that's the resource in your community. So they wanted me to let you know that their main offices in Harvey, Illinois, and even though they have a long name, South Suburban Senior Services of Catholic Charities, their phone number is much easier to remember. It's the 708-596-2222. And they also are mostly working remotely, so you would need to leave a message. So let's see. I think as promised, it was somewhere around 35 minutes. So I'm going to say thank you. Again, my name's Joy, the Benefits Access and Information Specialist. And that's my email. Our main number at AgeOptions is 708-383-0258, and it's extension 393. That's our benefits. So someone will help you. Yeah, so I think we're going to stop recording.